Welcome to Between Two Ovaries, your go-to for all things women's health.
A lot of people just say like, oh, my vagina.
Yeah.
And
Yes.
that's
all
not,
of the above.
That's not your vagina.
No.
Well, it is.
We're here to cut through the confusion, bust some myths, and give you the facts straight from the experts.
You cannot still believe the amount of people that come to a gynecology clinic saying that they don't look right down there and they need something doing about it.
We're keeping it real, bringing you honest conversations about topics that matter to you.
Everything goes back to the menstrual cycle. Yes, it's a low-risk procedure, but it's not a no-risk procedure.
From periods to menopause and everything in between, we've got you covered.
So whether you're here to learn, laugh, or just listen, you are in the right place.
As soon as I said it,
Hello everyone, welcome to this episode called Truth Be Told, the Women's Oral Health Perspective. So we're going to be talking about oral health, but from a women's perspective. And yes, that is actually a thing. So did you know that your hormones do affect your gums, and also pregnancy, the menstrual cycle and menopause all have an impact on your oral health? So today we're going to be cutting through the misinformation, giving you the facts, and hoping to make you realise that oral health is more than just a trip to the dentist. It also has an impact on your confidence and your well-being. So we're very happy to have another guest with us today. So this is Janine Doughty. She's a dentist and also a researcher, so she spends half of her time doing dental work and half of the time doing research. And we'd love to hear a little bit more about the kind of research you do, Janine.
Yeah, absolutely. Well, thank you so much for having me on Between Two Ovaries. I'm really excited to talk about this topic, and it's actually the first time that in this kind of forum I've spoken about oral health and women in particular, and really kind of making that argument that oral health is a feminist issue. And it's something we should all be thinking about as women for a number of different reasons that we'll cover today as we talk about it. So we're thinking about things like female hormones, how that makes us different from men, different points in our lives, and also thinking about other things like the caring burdens that we have or societal expectations about oral health. And a lot of what my research centres around then is things like oral health stigma, so how we experience feeling things like shame, a sense of embarrassment, maybe self-isolation about our oral health, but also specifically looking at women. So I do a lot of research with vulnerable women, so women who are sex workers. In the past, I've previously spoken with women who are travellers from traveller communities, women who've experienced domestic abuse, and looking at those sort of issues as well. I'm more recently doing a project with the WI. So we've looked at almost 1,000 WI members. We can talk a bit more about what we found, but looking at some of their main issues around barriers to access and what's going on with them getting NHS dentistry. So I hope I'll have some good bits to share with you today.
And
sure you will.
Yeah. I'm really excited. Like, honestly, I know that Alison first met up with you and proposed this episode, and I was like, I am not quite getting.
How are we doing on our?
As like a gynecologist, we're all about like the waist down. I'm a bit confused why we would be talking about teeth. And then when we had a chat about like what you could go through and hormones and pregnancy and various different things, I was like, oh, this is going to be great. Yeah. So I think that this is going to be really interesting for loads of our listeners. And in the age of, as we've said before, social media and cosmetic dentistry,
We'll
as
definitely
well
be touching
as
on turkey teeth.
Yeah.
Everyone on the
that
edges of their
hot topic.
seats. Yeah.
I feel like we're all going to learn a lot as well.
Yeah, 100%, definitely.
very excited for this.
So we're going to delve right in and go kind of back to basics. Can you tell us how women's oral health needs change over their life? So including puberty, menopause, pregnancy.
Yeah, absolutely. And I think this is something that perhaps is not a conversation we're even having as a dental profession. I don't know if it's something that you're having.
I mean, definitely not.
No,
Obstetrics, gynecology.
I don't think so. No.
Okay. So I think it's something that is important to mention. I mean, as dentists, half of our population are women, so it's important that we understand this. But we see changes at all phases of life. So we start to see changes first when girls are entering into adolescence. Okay, so they're becoming teenagers, estrogen is peaking, and we start to see changes in the gums. All right, and the way that the gums might look different is they might respond differently to plaque. Okay, so just to break down what plaque is, not everybody wonders what is this stuff, the gunky stuff that you see on your teeth.
I think you hear it on TV adverts, don't you?
I was going to say
Yeah.
toothpaste.
Get
Kill
rid of
the
that
plaque.
plaque. But what are we trying to get rid of?
Yeah. We're talking about something called, it's like we might say a biofilm, but it's basically a collection of bacteria, accumulates of food as well, might be food debris that haven't been brushed off the teeth for a period of days. And we're talking
like
about
a
sort of
cling
3
film?
to 5 days. A bit like a cling film that sort of sits on your teeth. And it gathers in little spots between where the gum and the tooth meet is usually where that's going to gather the most, and between your teeth as well. So that's why dentists are always recommending floss, because that's where that plaque accumulates. So what is happening in adolescence when that plaque accumulates? There might be an area where perhaps it's not getting brushed as much as others, and it starts to aggravate the gums. Okay, so we might see things like puberty gingivitis. Okay. Gingivitis is another one of those words that perhaps you've heard and we don't know exactly what it is. So gingivitis is where your gums get a little bit swollen, they're reacting to the plaque, and it's a combination both of the bacteria you got in your gum, but also then how your body is responding to it.
Right.
Okay, so when those kind of immune cells that we have that are there to fight off the bacteria, they also themselves can cause a little bit of damage. So it's not just the bacteria are bad, all right, but it's also our body's response to it that mediates that.
Oh my God,
well.
all the things.
All going on.
Yeah.
Gingivitis is when you've got swelling of the gum.
Yeah.
And is that something, because it's an itis, does that need an antibiotics? Does that need a treatment? What do you do about that?
Yeah. So gingivitis is a generally reversible stage of gum disease. Okay, so it turns up, the gums look swollen, they look red, they look angry. You brush, when you spit out afterwards, you see a bit of blood. Okay, and that is gingivitis. And the best thing you can do about that is have absolutely immaculate oral health. Okay, so I say absolutely immaculate, but as best as you can achieve with what you have available to you, which might be either a manual toothbrush for some people get on well with that, or to make life easier, an electric toothbrush.
Yeah.
So it's important, I think, for us to understand these terms, because as we come back and forth across the session and we're talking about it, we'll keep coming back to gingivitis, we'll keep coming back to sort of other forms of gum disease as well. So gingivitis is reversible with good oral hygiene. What is not reversible is something called periodontitis, and that's where the bacteria go deeper down into between the tooth and the bone. Okay, and that's when we start to see, that's when teeth can get a little bit wobbly. Okay, so it's more than just that bleeding. You start to get potentially functional issues and problems. But when we're thinking about adolescents, or when we're thinking about teenagers, we're thinking about those bleeding gums. Okay, and that's related a lot also to estrogen. So estrogen does a lot of different things in our body. Both the presence of estrogen, so having it there, but also the withdrawal of estrogen that we might see in menopause. Okay, so both of those can cause different issues for your oral health. So in adolescence, we've got lots of peaking estrogen. Okay, and that causes issues for a number of different reasons. It changes our immune response. Okay, so the way our body reacts to the plaque, it can change the bacteria that live in our mouth. Okay, so some of them can use that almost like a food, or what we call metabolite, so they can use that estrogen. So you get different composition of bacteria in your mouth.
I've never thought about that, but it's so obvious because we always talk about the menstrual cycle, fluctuations in hormones and how that affects your uterus and your vagina and the vulval skin. But obviously, of course, that will affect your mouth as well and your whole body, I suppose. But I can't believe I've never even really considered that estrogen would affect your oral hygiene. But it's so obvious when you've laid it out so well.
And I think we see that more as we progress into older age, that kind of similarity between, we'd say, like the oral mucosa, that's the lining of your mouth, and the lining of your vagina, because of oral dryness. So we see people often complaining in menopause, mouth dryness, you've got that estrogen withdrawal, and we can talk a bit more and delve into menopause shortly, but that is a really big issue for women, is mouth dryness, and there are several other conditions that occur around menopause that we can talk about. But yeah, adolescence, we see changes. Pregnancy is a huge time of change. Right? Hormones are elevating, things are changing so rapidly that often women experience pregnancy gingivitis. Okay, bleeding gums during pregnancy. That comes on, that is a thing. I had it as best as I could try with my flossing, meticulous oral hygiene. Your gums are they're more inflamed, they've got more vessels. It's that process of, your body makes more vessels. Not just in your uterus, but everywhere. So you make more vessels in your gums.
So if you get gingivitis when you're pregnant, that's not necessarily you've not been brushing your teeth enough, that's just everything that's going on changing?
I would say that your oral hygiene has to be meticulous. So for me, there must have been some bacteria there. Because
I'm like, are you judging us?
No, I'm just asking.
It's all good. It's good to have these open conversations. Because, do you know what? Perhaps I wasn't brushing as well as I could have been. Now, when I'm in the dental practice, what I can do is I can have something called a disclosing tablet. I munch on it and it turns my teeth purple.
I've had a child.
And it shows me where the plaque is. Okay? And so in between your teeth, maybe I needed to floss a little bit more. So
maybe when you're pregnant, have a disclosure.
We're all human.
Yeah. We're all human. Get your floss in there and do that. But yes, it does make your body more responsive. So if your mouth was completely free of bacteria, you wouldn't be getting any gum disease. It's that interaction of the bacteria and our body. And as you guys will know, when you're pregnant, your immune system changes.
Yeah.
And that's can be upregulated and can cause issues.
Yeah.
Wow. It's
So,
huge, isn't it?
yeah.
All the different things already.
It's huge. And I think maybe in a bit we'll focus on menopause a bit.
Yeah,
Okay.
definitely. We'll go
Yeah.
into that for sure.
When
Go
you're
on,
talking about, you're like, you can have a bit of blood in the sink when you're spitting out from this. I feel like the adverts on TV are like, if you've got blood in the sink, then you're probably going to die. It feels like
yeah.
it extrapolates very quickly to this is
Yes.
a really bad thing. But you're saying it might just be a sign of something else going on.
Yeah, it might be a sign that your body is responding in either kind of a diminished way, so like a lower way than you'd expect, or in an overactive way than what you'd expect. But it does mean that you need to improve your oral hygiene.
Yeah.
If it's gingivitis, brush really well, do your flossing for a couple of days. That's probably going to settle down and resolve itself. Do make sure you get your regular checkups though. Advocating for the 6 to 12 monthly checkups, because if it has advanced to something called periodontal disease, which we were just speaking about, that more advanced form, that's underneath the gums where you can't clean. Okay, and you might need some professional cleaning for that.
So it's kind of like a little warning sign. If you see a bit of blood in the sink after you brush your teeth, that tells
Exactly.
you there's something that needs to change to prevent it getting
Exactly.
worse. Yeah, okay.
And I say to patients like, if you see somewhere that you're flossing or you're using your little interdental brushes and you're seeing a bit of red, take that as like a red flag to a bull kind of thing. That's the area that really needs your attention. That's the area that needs your focus and energy. Don't avoid it. Because so commonly patients will say to me like, oh, it bled there, so I didn't want to brush. And I'm like, no, the opposite is true. You need to really brush when you see that area that's a little bit red, a little bit bleeding between your teeth.
Can you
get the floss
brush
in.
too hard? Is that a thing?
Yes, yes, you can. Yes, you can. So a lot of people like a hard brush, but I'd always say go for a medium bristled brush.
There you go, there's your advice.
Yeah, and you want to do like nice circular motions if you're worried about gingival recession, kind of brushing slightly more downwards on the gum rather than upwards. The issue with brushing hard is that it can cause gingival recession. So your gums become aggravated and they start to pull back from your teeth. You might get a bit of sensitivity with that as well. So yes, you can brush too hard. And if some people do really go for it, you can sort of wear away the teeth a little bit over time if you're using a very hard brush with a hard technique. So
Don't know if everyone else is just feeling their
Yeah,
teeth
my
with
tongue
the
can't stop. It's like,
assessing everything. Thinking about the sort of impact of hormones then is a lot of women will be on and girls will be on oral contraceptives for periods but also for contraceptive reasons. And does that have an impact on their gums and teeth as well? Yeah.
Yes, it does do. In the same way that pregnancy does, you have those elevated hormones, albeit they're not body identical hormones, they're probably a synthetic hormone in a contraception, but it still has that same effect. So you may well start a contraceptive and then think, I'm seeing more red in the sink when I spit out. Focus more on your oral hygiene, and it maybe you need to change what you're doing to introduce that that electric toothbrush or introduce your interdental brushes, because your body will now be having a different immune response.
So it's not a reason to stop the contraceptive, it's just you maybe need to be a bit better with your oral hygiene.
Exactly.
Okay.
That's what I would say.
That's good to know.
That's the key message here.
Yeah.
In pregnancy, you've obviously got really much higher levels of hormones there. Does that have any other effects? I feel like people have said before about if you have a brace, your teeth like move at a different rate, or if you having different work done on your teeth, you need to be careful. Is that true?
So there are some misconceptions around pregnancy.
Okay.
So some people tend to avoid like small X-rays, for example, because they're worried about the developing fetus. But the beam of the X-ray does point in a different direction away from the fetus. But thinking about dental treatment, you are very safe. So there's no contraindications to having dental treatment, going to the dentist and having a clean while you're pregnant. But what we do see with pregnancy that I want to bring up here is that we do see, and there is strong evidence to suggest there's a relationship. I can't say one thing causes the other, but there's a relationship between poor oral health and pregnancy outcomes. Okay? So pregnancy affects your oral health, but then your oral health can also affect pregnancy. So there's quite strong suggestion to say that. Now, the evidence is out in terms of treatment. So if you have dental treatment, you go and get your scale and polish. There's sort of a mixed range of kind of evidence to say that makes any difference.
Okay.
But what we can start to see is that evidence that suggests if you've got some problems with your oral hygiene, your gum disease, it can be related to things like low birth weight, preterm birth, or a combination of the two. And preeclampsia as well has an association.
Gosh, it's really interesting, isn't it?
Pregnancy is often kind of like a but like a window to the future kind of thing. I always think of it as when someone gets gestational diabetes, so diabetes in pregnancy, it's probably because they're more likely to get it later on in life, and if they adapt their lifestyle, then they'll be less likely to get it later on. I wonder if it's the same with the oral health as well. Like if you get gingivitis in pregnancy, or if it's associated with like low birth weight and preterm birth, maybe that's a sign that you need to improve things for your general health in the future as well.
I think so too. And I think going into pregnancy with really good oral health is a good position to be in. And it might be that that's the trigger that gets you to improve your oral health. Pregnant women in the UK, if they can find a dentist, get access to dentistry free on the NHS. So that's a really good time to engage with a dentist and start talking about your oral health. But I just want to pick up on something that you said there, Alison, about diabetes, because there are, and I'm not sure if everybody knows this, maybe you've come across this or not, but there's a relationship between oral health and diabetes. And that is one of the kind of strongest links that we have between oral health and general health. And that also stands in pregnancy around gestational diabetes as well. So oral health can worsen your blood glucose control if you have diabetes. And if you have poor blood glucose control, it impairs your immune system function. And it can also impair your sort of blood vessels in your gums and affect your gum disease.
A vicious cycle.
Yeah. So it's another thing to think about.
Saying is that we need to look after our teeth.
I want to go home and brush my teeth right now. I'm like,
And for more than just having a good smile, actually, for your general health and specifics, if you have diabetes or if you are pregnant, there's actual real benefits to looking after your oral health more.
100%.
It feels like a lot. Like I didn't quite get the relationship that was going to be there, basically. So with regards to menopause, we touched on it before, and as soon as you said it, I was just like, okay, so dryness at the top and the bottom. And I was just like, so what can we have a lot of listeners that are menopausal or going through the menopause? What can they do to assist themselves? We've done episodes before on kind of exercise and making sure that they're strong, as in weight bearing exercise, because that can help with their bone density and keeping active. And we've discussed about HRT, but what can they do with regards to their oral health?
Okay, so I probably need to take a step back to that and just sort of explain to you what goes on then when we enter into menopause and what's happening in our body. So obviously through the menopause you do get your wild fluctuations of hormones, but I'm going to think about sort of that post-menopausal period.
Yeah, so we know that everything's kind of
dropped off.
So if you're not on HRT, your estrogen and progesterone will be very low at that point.
Thank you. Yes, exactly that. Thank you so much. That's an excellent explanation. So at that point, what we see is all the impacts of estrogen we sort of see are dampened down. So estrogen also regulates, as you know, with osteoporosis, kind of regulates our bone and our bone turnover, and that slows down in the menopause. That has impacts for teeth too. Okay? So what we see is the bone that's around our teeth, that holds our teeth into our jaw, that starts to recede, and women who have more osteoporosis for longer see more recession of that bone around the teeth. So women might start to notice things like receding gums. During that kind of going through menopause phase, when the hormones are up and down, the gums might be quite swollen. But afterwards, when the hormones are low, we might see like a very pale, kind of shiny appearance, and women might experience things like dry mouth as well. So with the dry mouth, it depends on each of the symptoms that arises as to how we would treat it.
Okay.
I think dry mouth tends to be a very common problem, but alongside those things we're talking about, the gum disease, dry mouth, dental decay, we see other issues around menopause linked to facial pain conditions.
Okay.
So burning mouth syndrome, which is a very, as it sounds, burning mouth syndrome, a very sore mouth. It's actually a condition of the nerves, so say a neuropathic condition, but a condition around nerve excitability. So that estrogen going low makes our nerves overreact and send pain signals to our brain. And that can also be linked with pain in your jaw joints as well. It affects the jaw joint, so
you're just checking
You're just everything over as we're talking.
so you can get some sort of degeneration of the jaw joint, and you can also suffer from other nerve issues like trigeminal neuralgia. So we do start to see this kind of pocket of chronic facial pain issues coming in between like 45 and maybe 60. We're seeing like a much heightened prevalence.
And they're more common in women than men then around that
yes.
age because of the effects
Yeah.
of the low estrogen due to perimenopause.
Yes,
Okay.
they're much more common issues in women. I think about 3 times as much, depending on the condition.
I feel like women are a bit bad.
We
like,
do.
So much to look forward to.
It's not fair.
I don't know if this is, if you know the answer to this, but if the low estrogen around menopause causes these, potentially increases the risk of you getting these like chronic syndromes with your tooth and your jaw, does HRT improve them, or is that not known?
So the evidence on this varies.
Okay.
Is what I would say, and it's condition specific. So for dry mouth, HRT has shown some improvement.
Okay.
So that's really in the same way that it would improve vaginal lubrication
Yeah.
as well. You anticipate that might improve with HRT. So similarly in the mouth, some women find that they have a better sense of oral well-being, is how it's reported. And you also see different things like changes in the bacteria that are in your mouth when you start to take HRT. So it does change. But then there are other facial pain conditions that haven't shown much of a difference in relation to HRT, but some of them resolve themselves kind of naturally. So some of them don't. Some of them, like trigeminal neuralgia, may need treatment with some drugs. We use anti-epileptic drugs like carbamazepine, for example, usually a first-line drug for that. But with burning mouth syndrome, it may be that might diminish or get better over time by itself.
I didn't know this like dry mouth situation.
No, I know, and it seems again so
I'm
obvious
worried about
because
it already.
I think we've got a few years.
I mean, we obviously know that women who go through menopause often have vaginal dryness. And I
Yeah.
think that's generally quite well known in the population,
Yeah.
would you say?
I
It's
think
not
people
just 'cause
talk
we
about
do.
that more.
Yeah, but then of course it would affect your mouth as well because it's the same kind of skin lining.
So when I've been on a cruise before to visit my sister, I took anti-sickness like patches, and that gave you a dry mouth, and it was horrendous. I was just honestly terrible. It was great because I didn't feel sick.
Yeah,
so
we
you were
love
weighing
that.
it up against each other.
Pros and cons.
But the like the dryness was just intense. Like you just needed honestly.
Speaking
like,
about
are
it is
we
making
dry?
my mouth dry.
I couldn't imagine having that all the time. Like I could have it for like the time that you're away or you're using the medication, but not for like forever.
Yeah. And it does cause issues. It causes issues with eating,
Yeah.
swallowing, talking. For example, if people wear dentures, you might hear a clicking sound or the tongue is sticking to the roof of your mouth. But you know, I feel I've highlighted a lot of problems here, and I do want to say that there are things that we should be thinking about that can help women. Okay. And much like with with vaginal dryness, you might recommend a lubrication.
Yeah.
Okay, so there are salivary substitutes that you can get.
Okay.
So what's really important about those, they used to have some that were sort of lemon flavoured and things. Make sure that if you've got teeth, then you want to be going for something that's pH neutral.
Oh God!
Okay.
Imagine like you're
Burning
like
them away.
swilling these all the time, and you're like,
yeah.
oh my God!
So
no
you
teeth
need to
left.
be really careful. And some people do like to sip something that is sweet. Now there couldn't be anything worse than sipping something sweet when you have a dry mouth. And the reason why I say that is, you know, saliva's not just water that exists in our mouth. Saliva's really important. Okay, it's like an acid neutralizer. It is what we'd call like a buffer. So if you have a fizzy drink, if you have some sugar, your mouth becomes acidic. There's lovely saliva, just kind of over time, say a half an hour or so, kind of washes it away, clears everything away, neutralizes your mouth. But that effect doesn't happen when your mouth is dry. The sugar stays on your teeth. The acid doesn't get neutralized, so you get much more prone to getting dental decay. So sipping water is absolutely key there. You can use your saliva as either a spray or a gel, as you wish, whatever you're more comfortable with. And that can really help to alleviate some of the issues during the day or if you're speaking, eating. Yeah.
Good to know.
Does like staying hydrated in general help with that as well?
I would say that staying hydrated is a good idea. Whether that's going to like objectively improve the symptoms, I'm not sure. But I think lubricating the mouth, having a drink of water is a sensible idea, yeah.
Yeah. And so obviously we've heard about all the different things that happen in the different parts of women's life and their oral health. What is it like overall compared to men's oral health?
Yeah, so men's oral health is quite different. And I was looking into just, you know, what's going on with testosterone? What's happening here?
What's she
doing? And there was a really big study that included loads of other studies. And it was looking at testosterone. Does it make a difference? And really what they found was, it seemed the jury is out to an extent. So we're looking at, does low testosterone have an impact? Does high testosterone have an impact? And there were mixed findings there, that some studies suggested higher testosterone might affect your gums, some lower testosterone might affect your gums, but I couldn't see that there was like an answer to that question. So men's hormones just don't fluctuate in the same way that ours do, and they don't seem to have that real cyclical change or that life course change. We see those changes at certain really important points in our lives. So it's not the same way, but don't get me wrong, I don't want to take away from the guys here, because they do experience oral health issues. So men do experience dental decay, men do experience gum disease. Oftentimes they might attend the dentist less than women, so they might potentially have more untreated disease as well. So there's differences in the way that men and women, not just how they experience what's going on in their mouth, but also how they deal with that in terms of going to the dentist and seeking care.
Okay. So everybody just needs to be better, really. Not just women.
Not just women.
So we wanted to take a bit of a sideways move, if that's okay, because we wanted to have a look about, we've spoken about HPV, we've spoken about smears, cervical screening, and we wanted to know about the factors that are driving the faster rise of oral cancer amongst women v men, because I think it's been a cancer that we've discussed that men would get more often before, but that's not kind of just the case anymore. So can we help? Can we reduce the risk of this?
Yeah, I think that's an excellent question. And when we look at what's been going on and we look at the bigger picture, men are still more likely to get oral cancer than women, but the rate of oral cancer, so the number of cases, has been increasing more rapidly in women. So there's a number of different reasons for this. Okay, so we've seen changes maybe in sort of smoking patterns in different social groups, for example. So we've seen certain groups maybe going away from smoking cigarettes and people moving towards things like hand-rolled cigarettes. So I know it's been, the changing pattern in smoking has been quite a big trigger there. But HPV has also played a part.
Yeah.
And
it's our buzzword, isn't it? HPV.
Should we let's just have a quick what is HPV? Why do men? Why have we discussed that men sometimes get more oral cancers? So let's go into that first.
So HPV is human papillomavirus, which is a virus we often associate with cervical cancer. So it's a virus that most people will get in their lives. So for women, it often is in the vagina. You won't know you have it. It's asymptomatic. But if it is there and it stays there, then it can cause changes to the cervix, the neck of the womb. And those changes can become precancerous, and if they're not treated, they can become cancer. So that's why going for cervical screening or going for your smear is really important, because it can pick up if you have HPV, and then it can monitor you and give you treatment if you need to. In a similar way, HPV also affects your mouth, so it can also cause oral cancer. So this is an area I don't know much about. So I don't know if you want to add anything to that.
Absolutely. So it tends to be, with the HPV-related cancers, it tends to be oropharyngeal cancer. So it's cancer that's further back. So it's by
like
your tonsil
and your throat,
and your throat, rather than in the mouth, like the bottom of your mouth underneath your tongue. That tends to be more related to things like smoking and alcohol. And the reason why is that's where your saliva pools. Your saliva will have the alcohol in it. Your saliva might have the chemicals from smoking in it, and it might gather at the bottom of your mouth, for example. And I think one thing I do want to mention to the listeners about smoking and alcohol is that smoking separately and alcohol separately increase your risk of oral cancer, but you put them together and it absolutely multiplies that risk. So it's not that, so maybe smoking is maybe you're sort of, I think 10 times more likely to get oral cancer than a non-smoker. And if you put alcohol into that picture and you're smoking and drinking regularly, that increases again times 4. So, so I think it's sort of 40 times. So you get what's called like a synergistic effect. They work together because the alcohol damages...
Not in a good way.
Not in a good way.
Fuel on the fire.
Not in a good way.
Not a good tea.
Yeah, so the
Working
alcohol
against
makes
you.
your mouth more sort of permeable. So that like chemicals can pass through the lining of your mouth. That's what happens with smoking. But yeah, HPV, I mean, there's a difference that we see in the patients who are coming with HPV and the patients who are coming because of oral cancer from smoking and alcohol. So smoking and alcohol tends to be sort of older patients. Whereas HPV-related cancer, it's maybe a slightly younger demographic. We do still see higher numbers of men with HPV-related cancers than women. No, this is just in the general population.
Just all men.
Yeah.
Okay.
Can I ask at that point, because at the moment we're at a point where the HPV vaccine has been around for a while, but it was, so when I was like 20 years ago it was brought in, so then it was just for girls, and then as time's gone on we've increased the number of HPV strains, the different types of HPV that it covers, but we also now vaccinate boys and girls. does that have an impact on who we're seeing with HPV related cancers now? Are there more men because they weren't vaccinated 20 years ago?
That is a really good question.
Would you know the answer?
I think when we look at the studies on this, we're looking sort of further back than so we're looking to maybe sort of 2011, kind of 20 years prior to that, and looking at the increase. So I was looking at some of the studies showing that there's been this huge increase. So I don't know if because of age we'll have yet seen everything play out yet, because if girls were being vaccinated around age 12, that started about 20 years ago, they'd be in their early 30s now, and the kind of group that we'd be seeing with the HPV related oral cancers might be in their 40s. Right. So they're younger, but they're still in that sort of...
So we might not see the
so we may see that. But what we do know for sure, and what is really important, is that when you are vaccinated for HPV, you see a reduction in HPV. I think it's around 83-84% of people see that reduction in the throat, so in the oropharyngeal region. So that's effective. That doesn't matter whether you're a boy, whether you're a girl. That vaccine has a good likelihood of reducing your risk of HPV-related oral cancers. So it's a good
Get your vaccine.
Yeah.
Brilliant.
No, definitely. So I think if we're done with that, I think all the dental issues we've talked about have made certainly me cringe a bit. And I think if I had them, that would have like such a huge impact, obviously on my mouth, but like self-esteem, confidence, like well-being generally. What are some of the most common ways that women might experience the stigma, do you think?
Oh, that's a really good question. I think in this day and age, and maybe you guys have felt this yourself, there is such a focus on appearance. Yeah. Like whether that's a Teams meeting where your face is on a huge screen and you see yourself, or whether that is on social media and everybody's taking photos and videos of themselves all the time. And I think that there's always been a media narrative around the attractiveness of women and how that's perceived. And part of that is around our hygiene and how we look after ourselves. And so there are expectations on women that I think we experience, and that makes women very self-conscious about their oral health.
I feel like having a nice smile is like a big thing for people as well.
Yeah. And I think there's a few points I want to touch on here, but it can certainly impact like people's day-to-day lives. So many women that I've spoken to, just even in the past couple of weeks, in terms of the research I've been doing, are talking about things like, I cover my mouth with my hand. I don't smile. I cover my mouth with my hair. I wear a scarf. I've spoken to women who have told me about never having taken a photo of them smiling with their children because they always put a scarf over their mouth and don't want to have those photos.
That's so sad.
It is so fundamental to our identity. So our mouth, it carries 1/3 of the weighting of the attractiveness of our face. Okay, so 30% of how attractive we are is determined by our mouth. And you might have seen...
No pressure.
I know, I'm like, who does she like?
I don't know if you've seen it. There's like these... little, not memes, but I want to say like little videos on social media that come up with Anne Hathaway or some celebrity, and they change their teeth.
Yes,
or Margot Robbie.
they put them in like the shape of the ideal.
Yes, or they give them like all sorts of different teeth. That make them worse, and did different kind of appearances to show, well, what would this person look like, and how much are their teeth determining their attractiveness. And I think as women we feel this and we live this, so it affects. It's not just our teeth and our looks. It's also our breath and our willingness to kiss and our ability to eat. So if you're, missing a tooth, and so if food is visible when you're chewing, there's so many social elements to it. People don't want to go out and eat. If you've got a dent, you have to clean afterwards. There's a lot to think about. I think for men and women, this affects men and women, but I think perhaps women maybe more acutely because of some of these social aspects around attractiveness.
So it definitely could affect like relationships and stuff as well.
It could totally affect relationships, and there's a lot of research out there to suggest it affects potentially employment opportunities. It potentially affects how intelligent people think you are, how competent people think you are in terms of like having relationships with other people. So we can see that, and just the other week I was talking to a lady who was doing some work with sex workers, and she was saying even if I detox. And these are her words, not mine, but she said people are going to see me and they're going to think I'm a smackhead, even if I've completely detoxed off of drugs and trying to rehabilitate my life. So oftentimes when people are doing that, reclaiming their lives, part of that is getting whatever you need to feel like the inside version of yourself matches
Comes
what
through.
everyone else sees and what you see in the mirror.
Yeah.
This is
Yeah.
making me think of those horrible makeover shows on TV where people often, once
can
they
see
get the
something
veneers, which are
like
probably not great, but they get a completely different smile, then they're completely transformed in terms of their
Yeah.
confidence. And you can see how that would affect every aspect of your life, because if you're not confident enough to smile and you're constantly thinking about your mouth, you're not going to want to go and talk to someone new, make a connection, go for a job, any of those things. It's going to really affect you. You touched on sex workers, and we wanted to ask about this because obviously we're coming from a women's perspective, and there are male sex workers, but there are more female sex workers out there, and equally there are more women who are sufferers or survivors of domestic abuse.
Yes.
And we wondered if there are any kind of specific oral health challenges for these groups of people.
Yeah, definitely. So in terms of sex workers, I myself have been learning a lot recently because we've been going out, we've been doing interviews in the community, so we've been sitting down, talking to the women and trying to understand like what's going on with their oral health. And it impacts them in so many ways that perhaps we hadn't even considered. So it impacts their work. Their work is sex work. If they're performing oral sex and they have sharp teeth, sometimes they, as they express it, get into trouble with the client. They experience it as biting them or scratching them. So there are real implications for the women as well as the way that they look and wanting to change their lives. But many of them mention things about filing down their own teeth. Their
don't
teeth,
say that.
yeah,
I can't even file my nails.
their teeth just spontaneously kind of coming out in their hand in the supermarket. We were hearing stories about that, and obviously abuse as well. So being punched in the face, we were shared stories about people who had their jaws broken or lost teeth as a result of that, or front teeth broken and things. So we're seeing this whole number of different things going on for these women, and I learned things I didn't know. I knew drugs are bad for your teeth. Okay, I think that was kind of self-evident, but the women were able to explain to me what happens. Okay, when I take heroin, I get cravings for sugar. When I take crack, my mouth is extremely dry. And what did we say about saliva? It's so protective. So if you're taking heroin and you're taking crack together, that creates an environment where you want lots of sugar and you have very little saliva to wash that away. So the teeth very, very quickly, even in a matter of just a few years, are breaking down, as they refer to it, sort of crumbling and disappearing. So we see that a lot. And the big issue, of course, and I think this is like an absolute national issue, isn't it, is then accessing a dentist.
Yeah, because it's not, well, it's expensive, isn't it? It's hard to actually get access to a dentist if you don't have a fixed abode, somebody that you live, or even if you do. Even if you do, it's hard.
For everybody, the amount of NHS dentists seems like they've gone down, and people are changing now to private dentists, which can be very expensive. Getting an appointment at a time that actually suits you is very difficult, and I know there is a crisis with regards to that, but when you've got on top of it that you've maybe got no fixed abode or you're working very unsociable hours or various different things, I suppose priorities perhaps change, and keeping that as a top priority might be quite difficult.
Definitely.
Absolutely.
I feel like it's something that even I like forget about. I'm like, oh my god, when did I go to the dentist last? I've forgotten. I do actually know, I went quite recently, but before that. And with these barriers, what can we do to try and like get past them?
Yeah, I think that is a really good question at the moment. I think when I think about, so all the women who responded for the WI, we've got quite a different group here.
Well,
Is that the Women's Institute?
Yes, that's the Women's
I
Institute.
was like, is that WI?
Yeah.
And that's sort of an older demographic?
Yeah, a slightly older demographic. So when we think about that demographic, they're women who perhaps have health agency, they can afford to pay for that WI membership, which perhaps says something about themselves.
They've got time for it.
Yeah, and yet the responses across the board were that people were struggling to get into a dentist or struggling to find a dentist, and they were able to ring up and ring around lots of people, travel because they had a car. So there are lots of issues, not just for some of the groups we've been talking about, like sex workers, but just, anybody, I think, women or men.
As well, if the dentist is open like working hours and you work working hours, then you're going to have to take time off work to go to the dentist as well. I had it with my dentist's back in Halifax at home, and I was trying to book an appointment, but you couldn't have the hygienist and the dentist on the same day, so I was going to have to go back for 2 separate days. I ended up going for the dentist, and she was like, oh, I'll just do it whilst you're here. But I was like, how am I meant to book 2 separate appointments for 2 different days in the same week? Tuesday and Friday. Do I go home?
And
do I
then
come
throw
back?
in like if you have children. So you
I
have to
think,
your
and I'm
children's
quite an
dental
open,
appointments.
flexible person, so I don't know how you guys can all do it.
Open and flexible.
Definitely.
But there's a system issue. And there are many reasons for this. It's very complicated, I suppose, in terms of like the dental workforce and how it's operated as a small business that's kind of distinct from the NHS or hospitals like that. So there's a lot of issues that go on there, and until has there ever been a really good emergency dental service? I'm not sure. But there tends to be like a provision for that basic emergency care. So if you have facial swelling, if you are in severe pain, there's often you can call 111 and you can try and get an emergency appointment at a dentist local to you, and that's fine for dealing with pain. Sure it is. But is that fine for regaining your function? Is that fine for getting you back on track so you can get a job or, and do those sorts of things? So the NHS and dentistry, could stand up on my soapbox here for a while, but it is not fit for purpose right now. And I think that's showing up for everybody. Yeah. It's interesting. Some of the women from that WI survey, they were even worried to move house because they were worried about moving away from their dentist. Yeah, and some of them travelling upwards of 150 miles or more round trip to stay with the same dentist when they'd moved because they knew the challenges they'd find, that it was easier to do that drive than to find an NHS
I still
dentist.
drive up home to Scotland to go to the
Yeah,
dentist. Yeah.
Me back to Halifax.
4 hours
That's
round, 4 hours each way. That's on a good day.
That's commitment to your teeth.
But it's every 6 months, and then I get to go home and everything gets done for me by mum. So,
I
there's
guess
perks.
it kind of shows how sadly the NHS dentistry, not just dentistry, but is kind of doing women a disservice, because as we've outlined, if there's a lot of things that women are more at risk of in terms of their dental health and their general health, and A, we don't really even know about it, and then B, when we do want to do something, we can't get into the dentist very easily. We're just going to be starting at a back foot, and things are going to get worse and worse, and then you'll end up getting emergency dental treatment when you've got an abscess.
Oh God.
Yeah, we need to,
I suppose it's about education as well, because as you'd said about the sex workers that you'd spoken to, or the WI that you'd spoken to, everybody, I suppose if that genuine level of education is there, and what you've spoken about with alcohol and with smoking, and we haven't touched on, what about vaping?
That's interesting, isn't it? I think the evidence it is emerging here that it's becoming a problem.
Yeah.
That it's becoming a problem for your oral health. I think, are you seeing this in general health
I
as
feel
well?
like it's got to.
Yeah.
And also I'm very concerned that it's something that everybody's taken on, and I'm saying everybody because it's loads of people that never smoked suddenly vape, and you're putting something in your mouth that it hasn't been around for ages. I'm just worried that in 20 years time everyone's going to get some funky oral cancer that we haven't heard of, because we just don't know about. That's why when people took up smoking, they didn't know it was going to cause oral cancer. I do think it's an odd situation that we've got into with the vaping.
Yeah, there's such mixed information out there as well. Some people are like, oh, it's better than smoking, then others are like, no, it's not.
And I'm like, but if you weren't smoking, why are you vaping?
I guess it's that thing where if you are a cigarette smoker, and you've stopped smoking, but you start vaping, that's good. But if you're a non-smoker and you start vaping, then that's bad, isn't it?
We also don't even know if it is good, because it's not been long enough.
Better than the tar and the, what's the other thing?
For your lungs,
tobacco.
we think.
Yeah. But if you weren't a smoker anyway, and then you picked up vaping, you're going to be putting yourself at risk of other things that you wouldn't have been exposed to anyway. And that's the problem, I think.
Maybe we'll have this debate in a few years' time.
We'll come back.
There are definitely studies underway looking into this, and the evidence getting stronger all the time.
There's stuff about pregnancy, and that it's not. We know that smoking prevents people from getting pregnant, and vaping has also been related to decreased level of pregnancy. So you just kind of think, don't take up vaping.
Take Nick's advice, just don't do it.
Choose a different hobby.
So we have touched on this slightly, but we were talking about social responsibilities. So if you're a single parent, or if you have caring responsibilities, or if you don't have any money, or if you're unemployed, how would this affect your oral health?
I mean, I think all of those things can affect women. I think we see gender pay gaps in terms of what women have access to financially, depending on relationships. And we mentioned domestic abuse. We didn't go into that, but there may be things at home with coercive control around finances as well. Not that affects everybody, but for those who it does affect, it is a problem. We can certainly see issues around children. So we can see the efforts that women go into trying to get children into a dentist and trying to find them an NHS place. And oftentimes it's that caring responsibility that falls to women, whether that's caring for, we hear women talk about like the mother-in-law, or caring for their own parents, caring for their children, even still looking after their adult children and trying to get their adult children. So,
Sorry, Mum.
that kind of life admin, that is still, that falls onto women.
Yeah.
And whilst that may not directly impact oral health, it certainly impacts women's mental load and their well-being around trying to gain access to services. And we see certain groups disproportionately advantaged. So we've also mentioned sex workers, but women who are from traveller communities, there might be issues there around literacy. So we're seeing certain women who are more disadvantaged than others. And it may be that there are single mums who are reliant on food from food banks, for example. So we see that a lot of people accessing food banks are single mothers. And why is that important? Well, that limits the choice that you have in terms of the food that you're having. So you have slightly less control over maybe sugar content or the type of food that you want to choose, or having access to fresh foods. And we haven't talked a lot about diet, but diet's absolutely integral to oral health. You know, having both fruit and veg to keep our mouth healthy from things like oral cancer, but also avoiding sugar so that we don't get dental decay.
It's difficult, isn't it? Because we've just touched on eating for your health in lots of different ways. So whether that be preventing miscarriages, getting pregnant, having a healthy pregnancy, taking you through the menopause, being able to exercise. Diet is a massive part of it, and it's really easy to say out loud, eat the rainbow, have plenty of fruit and veg. And everybody can say it, but they're practicalities of whether you're unemployed, whether you work full time, whether you've got a family, whether you've not got a family. It's difficult for everybody because they've all got their own issues with why it's difficult. So it might be a timing situation, it might be a money situation, but the importance of that needs to be kind of that education underlined, that people are aware what it can do, basically.
And I'm assuming eat healthy would be the general advice for, keeping your mouth as healthy as possible. But I think eating disorders are quite commonly seen more in women than men. Like, how does that sort of affect your oral health?
So I do want to pick up on that, but I do want to just give a couple of tips as well, because I sometimes feel like there's a lot of problems with oral health, but also to just think there's some like actionable tips in terms of.
Oh yeah, we like that.
Before we move on from the sugar and diet, is thinking about how often you're having sugar. So people don't often know this, but in terms of sugar and its effect on your teeth, so it's how often we're having it, as well as what kind of consistency it is. So you don't want to be having sugar attacks, as I might call them, more than sort of 3 to 4 times a day at maximum. And that you might be thinking that's potentially a jam on toast, that's a glass of orange juice, things. We're not talking about having a pack of Haribos.
Coffee with caramel syrup in it.
Exactly, a coffee with a caramel syrup in, just like that. So if you're thinking about those as your sugar attacks during the day, you want to limit them and try and have them at meal times if possible. So if you are going to have that glass of orange juice, have it with your breakfast. If you do want to have a dessert or a pudding, combine it at mealtime, because saliva, very protective, is stimulated at mealtime, so it gives us a little bit more protection. So there are certainly things that you can think about. Cheese is really good at neutralising acid, so if you are having
You're on it.
I was sad you were going to say cheese was bad.
I was just like,
cheese is
good. Have a little bit of cheese.
Yay.
A little bit.
So earlier this year, plug for me, I did a half Ironman.
Wow.
So I did a triathlon event, and I had not done an endurance event before, and I didn't realise how much you have to eat. So quite literally, for the space of a 4-hour bike ride, I would be non-stop eating cake, chocolate, and anything that I could sort of put in to give me the energy that I needed to succeed in the race. And I was really conscious about my oral health and discussing this with friends, and we decided a great tactic would be to have small pieces of cheese in between
Little
these.
baby bell.
And try, I'm trying my very best to kind of neutralise some of that acid that's produced when you have sugary snacks. So, that can be a small thing. But if you do have access to a dentist, you can get high prescription fluoride toothpastes as well. Okay, so you don't have to use more toothpaste. it's better if it's in a higher concentration if you're very high risk. So if you know you're having that lots of sugar throughout the day, or there's a reason why, maybe you're exercising a lot, so you're having a lot of bits of sugar throughout the day, your dentist can prescribe you things like that. So
Is fluoride good or bad?
that's a really interesting question, and I think there's many dimensions to that. I think there's
not just good or bad.
Yeah,
Never easy.
Yes, it's never easy. I think that the best evidence that we have is that in the concentrations that we use fluoride, so in toothpaste, or in the low concentrations it might be in water in the UK, then it has been shown to have very little side effects or issues. Sometimes you might get a little bit of white spots on your teeth called fluorosis. Okay, there is some investigation going on in France around thinking about to what extent is fluoride an endocrine disruptor, is it? So I think that work, as far as I know, is still ongoing, but that's not something that we've looked at here in the UK in too much detail. We still recommend toothpaste with a fluoride in it, because fluoride is that active ingredient. If you have a toothpaste that doesn't have fluoride in, for the most part, it's not really doing that job of controlling the bacteria and what's putting the minerals back in your teeth. That's the best way I can say it. When you have sugar, the surface next to your tooth becomes a bit acidic and it kind of becomes a bit chalky. It loses minerals, and toothpaste helps to put that back in. But what we are seeing, just to mention, is new things are coming out all the time.
Yeah.
And just recently we started to see some pretty good evidence that toothpaste using something called hydroxyapatite. Hydroxyapatite is in your enamel naturally, so they can also help to do the same job that fluoride does, but they haven't been shown to have sort of such an impact on the bacteria and the microbiome in your mouth. Yeah. So
So when you said about the sugar, it's not actually about the amount of sugar, it's about it being spread out.
So if you think about your mouth becoming acidic, and when each time you have sort of a few sweets or something like that, your mouth becomes more acidic, more minerals come out of your teeth. So if you have, say, a bag of marshmallows, you eat it all at once, that's not good for diabetes at all. But immediately within sort of like a half an hour,
Good for your mental health.
If you need it, you need it.
yeah, exactly. So we take that and you might not feel very well, you probably feel a bit sick, but your mouth can then clear that. Mm-hmm. You can rinse with a bit of water, you can rinse with some fluoride mouthwash, and you clear your mouth, and done. It will return to a normal pH. What happens if you have that same bag of marshmallows and every half an hour you are having another marshmallow? Acidic mouth.
I was watching Molly May literally last night, and I didn't think that this would be anything that was relevant to today, but she was told by her dentist to stop drinking as many sweet iced coffees during the day. So she went back to the dentist and was like, I'm only having one a day. And she was like, it's really great. What I've started doing is making one, and I'll just take it with me and sip it all throughout the morning. And her dentist was like, why? Just as bad. So she was like, so now I'm going to drink my iced coffee quickly and move on with my day. And I was like,
but that's why you need that nice simple explanation, because you don't have that kind of background knowledge.
Taking the top off the Smarties and just going shh and eating the Smarties, and I'm like,
he's doing it for his health.
Like, what are you doing?
It's better for his teeth.
Then actually he's doing the right thing.
And then he's
in the right.
But it makes so there are some things I think people don't always realise have these sugars in. Ketchup, baked beans, these are they're quite sugar dense.
I eat ketchup in a 1-on-1 ratio with the chip.
Yeah, I find raisins and dried fruits are an issue. We see like the best and really well-meaning mums coming in. They're like, lovely, I'm giving little Johnny raisins every day, twice a day for snacks, and that's really healthy, isn't it? Because it's a fruit, but because it's dried, it's very high in sugar and it sticks to the teeth. So instead of that saliva being able to get to the tooth and clear it off, it's got a barrier of raisin there that stops the tooth. Yeah, exactly.
For the teeth.
So something consistency matters as well as frequency. So if you're going to have a toffee, if you're going to have a raisin, something really sticky, that's going to be on the worst end of things.
Yeah. Do be careful though with toffees, because my friend last week had a toffee and it took the bottom part of her tooth off.
Yeah.
Was that like her actual original tooth, or had she got a
No,
crown
I
on?
think it was a crown.
Okay.
Yeah,
Yeah.
toffees have a
But
lot
she
to
had to go
learn.
back the next day to get one put back in. The worst thing was she stole it from her dad, so then she had to go and say, sorry, I took your last mint.
Well, she did him a favour, maybe.
Yeah.
We're going to touch a bit about eating disorders, just going back again. We do this a lot, we go around in different tangents. But, you know, as Lorna said, women often have eating disorders more than men, if that makes sense. Yeah. They affect women more than men. So is there any kind of specific issues they struggle with and any advice that you could give to any listeners?
Absolutely. I think in terms of what we're seeing around eating disorders, the one that most obviously has the biggest impact on your oral health, your teeth, is bulimia. Okay, and it's that binge and then purge cycle.
So that's vomiting.
Yeah. So that's sort of eating a lot and then being sick. And the reason why this is an issue is, in the first instance, you might binge on something sweet. Okay, so lots of sweet foods going in, which is going to affect your teeth in one way, and then you get another effect, and that's the acid, the stomach acid that's coming up when you're sick. And over time, we've already talked about how our teeth don't really like to be in that acidic environment that happens. Stomach acid is very strong, and over time, that can start to wear away your teeth. And what's really quite common is the first thing people think about after they've been sick and then they're about to go out the loo is, let me brush my teeth.
Yeah.
And there couldn't be a worse time to brush your teeth because that acid has taken some of the minerals out your teeth. They're now really chalky. And you think about a piece of chalk. It's very fragile, right? You only have to run your finger across a piece of chalk for you to get some chalk on your other finger. It sort of comes away, doesn't it? Very much the same. When those teeth are in that chalky state, it's not good to then brush them with we talked about hard bristle brushes, but it's not good to then brush them because the enamel's fragile and it will come away and you'll wear away your teeth. So we do see some people presenting, it might even be the first sign that they have bulimia or the first time that a healthcare professional's noticed it because they come to the dentist and we can see the difference. The enamel on the outside of your teeth, it's white and it's strong. The dentine, which is the layer underneath that, is more yellow. So you start to see that dentine being exposed. And then you know you're going to have to embark on a really careful and very compassionate conversation with that person to ask, is there something going on? Yeah. But it might present other things. It might be somebody's drinking a lemon tea and they're having acid in a different way. But at least you've kind of opened up that conversation. So it's the same sort of things. Afterwards, you want to just rinse out your mouth. You could use a mouthwash that contains fluoride. Don't brush for at least a half an hour afterwards. And it's those sorts of things you can be thinking about protecting your teeth and using a high fluoride toothpaste in other times when you are brushing.
Right.
Yeah. So you say about like brushing away at the teeth in this state.
Yeah.
Is it better? I feel like this has always been a big debate. Do you brush your teeth before or after breakfast?
Oh my
The big
gosh.
question.
Yes.
Yeah.
This is the ultimate like chicken and the egg kind of scenario. So if you want to brush your teeth after breakfast, that is fine. Wait a half an hour. Okay, most people have a sugary breakfast of some sort. They may be having, different brands of cereal. I won't mention any specifically, but you might have different brands of cereal that contain sugar. You might have your orange juice. You maybe have a sugar in your coffee. Those teeth are a little bit chalky. They've lost those minerals, and we want those minerals to kind of get back in the teeth. The saliva to buffer it off so it's all nice and neutral in your mouth. And then about half an hour later, you want to brush your teeth. So that's really good. If you're worried after a meal, say your midday meal, you've had something sugary and you don't feel like brushing, you can always use a fluoride mouthwash and that will help as well. Okay. If you want to brush beforehand, that is fine. For those of you who are like brush beforehand people, that's okay. It's not going to do you any harm, but you might just not feel as fresh throughout the day. You might have breakfast and then think, I want that minty fresh start of my day feel.
And it might make your orange juice taste
Yeah,
weird.
it might make your
that's
orange
all
juice
an issue. Can't do it.
Now that we've gone into this, we have to also ask about chewing gum. What you?
I was
Yeah,
going to
I
ask
think
that
that's
as well.
awesome.
Yeah.
Especially sugary chewing gum.
Yeah, sugary chewing gum, we've just talked about things that are sticky and frequency.
Yeah.
So you have it in your mouth for a long time. However, xylitol chewing gum, xylitol can't be used by the bacteria in our mouth in the same way that sugar can.
Okay.
So it actually has a protective effect. So if you check on that chewing gum, most of them are xylitol containing different brands that I won't mention, but
Well done.
they are xylitol containing. So check in on that because there is some evidence to suggest that chewing xylitol chewing gum, it's not only the xylitol, but it's also the chewing stimulates your saliva. It's like your
checks
body's
saliva.
getting more saliva in your mouth. So you've got that kind of double protective action there.
Okay.
You don't use it it's not I'm going to stop brushing and start using chewing gum.
Yeah.
No, that's not the case.
Yeah.
You still need to brush because that brushing action is what breaks up that plaque and allows the fluoride of the toothpaste to get to your teeth,
Yeah.
okay, and get past that cling film on your teeth. So very much so, yeah, I think xylitol chewing gum is fine. Stay away from the sugary versions.
Yeah. Okay. We've talked a bit about women from like different marginalised groups. So we've talked about sex workers. We've touched a little bit on, you mentioned travel communities, and we were going to ask you a bit about that. So any obstacles that women from traveller communities face with regards to like oral health?
Yeah. So a few years ago, I used to myself go out in the community on a mobile dental van.
Oh, cool.
So it is a full dental surgery, including X-ray unit that we can drive out into the
Wow.
community.
That's
With
really
an extra
nice.
surgical box.
Yeah. So it's really helpful. Actually, when we went to do the interviews with the sex workers recently, the Dentaid van was there. So it's a charity that does dental work, emergency dental work
amazing.
and things. So that was there on the day. But I used to go out in a van, and we did go out to traveller communities as well. And still at our practice now, we see families from traveller communities. And we find lots of issues around literacy as well. So when women aren't able to perhaps understand a text message about when an appointment is, or understand any leaflets that we're providing, directions if they've got children that need referring to a hospital for having teeth taken out, they might not be able to access that. So there are lots of issues, and we find if traveller communities have been to a dentist before, this is not for everybody, but what I would say is from what I've seen, there tends to be more decay in people coming from travel communities than maybe in the general population. And that does mean that sometimes children have been, or parents have been reported for neglect, or been reported to maybe social services around children's well-being, lots of dental decay, or the dentist has noticed something that just doesn't seem right. And that can disengage, it's the right thing to report that, and it needs to be brought up, but that can disengage whole communities who then won't come to a dental bus, or they won't come into that specific dentist for fear of being reported. So some of those things do come up as issues. They're really legitimate issues for those communities, and tackling them as a healthcare professional, that just puts you into a complete ethical spin about
Definitely.
Making sure you're doing the right thing for everybody.
exactly. Yeah.
What about, are there any differences for those who are in transgender or LGBTQ communities?
Yeah, so there is, and we can see this in terms of the amount of decay. So we see more decay, LGBTQ plus communities. We see people who are transgender specifically feel like more ashamed about their oral health. They feel more embarrassed. They anticipate being stigmatised at the dentist because of being transgender. So they worry about going in. That anticipatory stigma. They're like, oh, this is going to happen. Even if it doesn't materialise when they get there, they're worried about it in advance. So yeah, we do see differences. And oral health and mental health. I mean, we've been talking about all these links, haven't we?
Yeah.
Oral health in the body, oral health and mental health. If we know in LGBTQ plus populations that there's more depression, more anxiety, that impacts on wanting to get up in the morning and brush your teeth, brushing your teeth before you go to bed, looking after yourself and taking care of yourself, and that can have an impact. Yeah.
And the reason for there being more dental decay is that part of it, that they potentially have barriers to looking after their own teeth and go to the dentist. But you also mentioned, or did you mention alcohol and cigarettes? Or,
Oh, I didn't, but we were going to talk about this.
Yeah.
There is,
Okay, yeah.
increased alcohol and smoking. And smoking is very much linked with gum disease.
Right.
So it does worsen gum disease, so you might see more gum disease in those communities. And I think...
I just thought about this, I don't know if you'll know the answer, but are there any kind of like transgender friendly dental practices or any initiatives that are there to try and kind of make it easier for people to access dental care when there are those barriers?
That's a really good point, and I'm not
sure.
aware of any. No,
I think it's difficult
I'm not sure.
because-
That's not to say there aren't any,
Yeah.
but I'm not aware of any.
Yeah.
You touched on people being kind of worried or anxious about their teeth, but that's not the only barrier. I think if you're transgender, because they worry about what name they can register with, what sex you're going to call them, and we see this a lot from the fertility side, because it's quite difficult to make sure that people feel like you know who they are and you've fundamentally called them the right name when they come in. So it's like all of the barriers, and I think making sure that kind of staff on reception and the dental staff and the nursing staff and everybody are kind of on board with, we've got the right gender for this person, or the gender that they want to be known as, and the name that they would prefer to be used.
That's so important, isn't it? And I think sometimes maybe medical history forms that you fill out in a dentist, I don't know, the categories can be quite limited. So I think that there's definitely some work that could be done in that space.
So we want to take another little shift, and we as gynecologists, and I'm sure that everybody pretty much in the health field, are seeing a lot of people that are going abroad to have various different pieces of work done. We have had a lot of people that have been fallen pregnant after they've had kind of gastric bands done, or we've seen people that have had vaginal surgeries to like change the shape of their labia, various different operations, and they've gone abroad for these operations, which feels like very scary to me. But what are your we've all heard the press about turkey teeth.
They are everywhere.
They are everywhere. There's like at least 4 or 5 sets on my street. I see them everywhere.
Love Island cast.
Exactly.
Sponsored by
Reality
Turkey
TVs,
Teeth.
Yeah. So what happens if you go to Turkey and get your teeth done? What are you seeing from the back of that?
Yeah, that's such an interesting and topical question to ask. And done bits and pieces of research in this, looking at like what are the news media saying about this, how are the news media promoting dental tourism to people. I think Love Island, you touched on it, is like the original source of promoting dental tourism that people tend to pick up on. And what I would say, and I want to recognise this, is we have talked about expectations on our appearance. We have talked about the change in culture. Often people who are going abroad, they might be vulnerable for a number of different reasons. They might be having issues around self-esteem with their oral health. They might be thinking, is this causing an issue for my relationships, my employment, all the things we've touched on. There are some pretty strong drivers
not
to
even
go.
just vulnerable in that, vulnerable in the sense of that they've gone to have their teeth done and they've come back with their teeth, their boobs, and a tummy tuck, and you're like, and pardon what? Like, it's mind-blowing that I think they get pulled into this actually if you pay for that then you can have that
just do an add-on discount
which is like enough if you're going to Centre Parks, but if you're going to have surgery done, like the add-ons feel like
I feel it's a big decision that has to have a lot of thought go into it, and if you go and then come back with something else, it's like, oh my god.
Yeah,
if you've got that one opportunity when the price is right and you're pressured and it's something that you want, you can see how you do end up going into it.
And if there's something that you're really insecure about and you think, actually, this could be fixed for only this amount of money that I'm willing to pay,
and you get a holiday,
people are going to do it.
And you're there anyway.
And everyone else is doing it, which makes it more accessible as well.
Yeah, and I think the more, exactly as you say, that the more that we see other people doing it, peers or influencers, friends, family members, we think, oh, well, they've had an experience. And some people have negative experiences and they will shout about that on social media and they'll tell you about that. But there's so many people coming for help on social media. So we're just analysing at the moment, like all the Facebook groups that are public, we're having a look at them and looking at what are people talking about. And so many people are seeking advice. And that might be advice as to like, which clinic do I go to, who's reputable, have a look at my teeth, what treatment should I get? But they're asking peer-to-peer. Like, this isn't asking dentists for support. This is asking for other people who have been and had their teeth done abroad. So we see people seeking information in this way, and that leads to disinformation.
In the wrong way.
In the wrong way.
You've got to be blunt about this. It's the wrong way. Asking other people their opinions is fine to take it and have it, like, fly over your head. But if you want an opinion on a medical procedure... then you need to ask somebody who's a medical professional.
Yes, and people are asking questions sort of mid-treatment. So we've seen people messaging on these groups and they're asking for advice going, right, I've turned up, I'm about to have my treatment, but the treatment plan has changed from what I thought I was going to have. So now they're providing this. What should I do? I mean, that is a very high pressure situation. To me, that is not informed consent. You're not really able to give consent. You're thinking, I'm here, I have a few days window and I need to get this done.
And you've already paid that money for
and you've already paid. Or the price of it changes. So that's what I've seen a lot as well. The expectations of what the price is then change, or there's a different assessment, and suddenly you're in a different country and you're paying a different price than you'd expected for a different treatment than you'd expected, potentially. And some people's experiences, fine, they go well, they go uneventfully, they come back to the UK, they feel happy with their smile, and there are some very reputable and credible dentists, all across the world, and Turkey included. But there are cases that don't. And then what happens to those people on return to the UK? They're left with stitches that potentially need to come out, or they get a toothache. So when somebody has a crown, you might call it a cap on a tooth, the the literature suggests, or the research suggests, about 1 in 5 of those teeth is going to die at some point and need a root canal treatment. When it does, it might cause pain, it might cause an abscess. So if you've gone abroad to have dentistry and you've had 20 crowns put on, there's a potential for 4 of those teeth to cause a problem. And then your provider is in a different country, a flight away, and suddenly people are looking for redress in the UK, and then it's either access through an emergency dental service, or some dentists don't want to take on that for fear of legal issues and other things.
Makes sense,
Which you can
doesn't
get,
it? You know, it's work that's been done elsewhere that most likely would not have been approved or done in the UK, maybe in that situation. So then you're trying to deal with the complications of that, and that for a dentist could be quite a vulnerable thing to do.
There's a cost. There's a cost to pick up on the other side. I think the British Dental Association did some work talking to dentists around this, and dentists were saying on average to fix an issue that had cropped up was about £500, but some as much as £5,000 to rectify some of the issues that were coming up. So that's expensive on top of the cost of what people have already invested.
So if we're thinking that we're worried that women are kind of being overly critical about their appearance, and then they're potentially going to get pulled to somewhere like Turkey, but there are definitely other places to have procedures done because they've seen it as a cheaper alternative. What are we thinking like long term regarding this? Because I've seen kind of like 18, 19, 20-year-olds have like full sets of turkey teeth. So what is the longevity of that? Like, what happens with that? And what happens with regards to their menstrual cycle? And what happens when they get pregnant? And, like, what are we going to advise people with regards to that?
That's a big question. Let me just talk about, I mean, in terms of the future, when we think about the younger you have dental treatment, like something big like having a cap on top of the tooth, we all have a nerve inside of our tooth. It's what feels sensitive when we bite on an ice cream. The younger you are, the kind of bigger that nerve is, and over time it sort of fills in with more dentine and tooth substance and gets smaller. So if you start to have a lot of your tooth kind of drilled down to put a cap on the top of it, the likelihood is that tooth is more likely to cause an issue. So you might get more problems if you're having a crown at 19 than you would do if you're having a crown kind of 30 years later. But inevitably those crowns will at some point need replacing. Okay, so you've got a lifespan, maybe 10, 15 years. If you're lucky, you get a little bit more. Depending what it is, it might be, what type of crown it is, you might get a little bit less. So there will be a point at which this treatment will need to be performed again, and potentially again.
You're signing up
as well.
for life.
You are signing up for life.
It's the same if you have a boob job, because they're not going to last for the rest of your life. And I think people need to be really understanding of this. If you're having your teeth done at 20, you're going to have to have a new set of teeth done before you
I didn't know that was a thing.
I think it's as well with like some sort of fillers, you can get them dissolved, or you can get implants removed. You don't get teeth again. You don't get your normal teeth back ever again.
It's completely irreversible. Like once that enamel is drilled off, you cannot go back.
It freaks me out.
It's a bit.
Also with it running with trends and stuff as well. So obviously it's a big thing to have like white straight teeth, but in a few years, you never know, like it changes. It might be a big thing to then have
Yellow crooked
a gap
teeth.
between your teeth. Well, it is. People can get this thing where they crack your jaw to get a gap between. You put like a pallet in the top, and you have to screw it each day to make a gap between your teeth.
People are crazy.
This is a long way to go for like beauty standards.
Just
So I
change your
suppose
eyeshadow, it'll be fine.
We're not going to be able to stop women or men seeking this kind of like cheaper dental treatment that will give them the smile that they want to feel more confident. And we respect that there are lots of pressures on women to get that. What advice can we give them to navigate it? So what would you say is, how can they find a good, reputable dentist abroad? What are the things to look for? What are the red flags?
Yeah, that's a good question. I don't have a repository of good dentists abroad. If you came to me as a dentist, I wouldn't have a clue. And I think most dentists would not know where to recommend you to go. And that is why people are turning to online groups.
Right.
They're looking for answers to these kinds of questions because they want to have an option that's more cost effective. But I think because of the quick fix nature of what's happening, people have a very short turnaround window, 7 days, they need that treatment done. They're not being offered the less invasive options that you might be offered in the UK. So whereas you might have, 20 veneers or crowns placed abroad, it might be if you've got longer, you've got 12 months, you've got 18 months, you might go for something like invisible braces. You might go for whitening. And then neither of those have a detrimental impact on your teeth, not substantially, and your teeth will have moved, your teeth will be whiter. and that will you'll put what's called a retainer in. It holds your teeth in place, and hopefully that's you done. Very kind of minimally invasive, that's the approach in the UK. The approach in the UK is very minimally invasive dentistry. Like, can we get you to where you want to be with the least amount of damage to your teeth in the most kind of long-term sustainable way?
Feels like the right way to
Yeah,
do
it feels
makes
ethical.
sense.
It feels right to me, intuitively, and that's because people are wanting this look quick. And this is all across the cosmetic industry, right? It's
a quick
quick.
I want to look good tomorrow or yesterday. I don't want to look good after my invisible braces have taken effect 6 to 12 to 18 months from now.
Yeah.
So I guess that's the thing. If it's a quick fix, maybe just consider that it's probably not the best thing for you and for your health long term. But if you're willing to take the risks, then that is you can't be stopped, I suppose.
Yeah.
Can I also ask about teeth whitening? So what's like good? What's dangerous? How do people do it?
I would say in the UK only dentists are able to prescribe tooth whitening. So if somebody who is not a dentist and not a dental professional or in a dental practice, they're in a beauty salon, they've got no dental credentials, they've no registration with the General Dental Council, then legally they should not be providing you with tooth whitening. Okay? There are different types, different concentrations you can get of hydrogen peroxide, which tends to be the bleach that we use, but there's also another which is carbamide peroxide. It's a bit more like a slow release that you might wear overnight, so it kind of works overnight. You can have in-chair. So you have a whitening, often with a heat or a light, and that tends to be done sort of in one session, and you might be able to top up afterwards at home. Or you can have looks a bit like a shield, and you use your bleaching at home during the day and overnight. The biggest risk tends to be sensitivity, and most people, I think it's something like 60 to 70% odd, will get some level of sensitivity. More with the in-chair whitening, because it's more sort of a bit of a shock to your teeth. It's stronger, it's on for longer. Whereas if you use, like, for example, the nighttime one, it's slower release, it's a lower percentage of the active ingredient, so you get less sensitivity. And when you're at home, you can stop. So if you are having, wake up in the morning and think, oh, my teeth are really tingling, that night, you don't have to put your whitening trays in. Whereas if you're sort of in-chair whitening, you're there and you're having it done. So
you paid.
You're paid for it now. Yeah.
What about stuff that you see online? Like, I get it all the time on my TikTok adverts from TikTok Shop of teeth whitening.
I'm really interested to hear about that.
From TikTok Shop.
And it's like £4.
Yeah.
Like, obviously people are going to see that, and people are posting videos and they're like, here's my before and after. It's great. Like, it looks real.
Yeah.
So I could have anything in
any
it.
concentration.
You get it off Shein.
Exactly. You don't know what's in there, and it's any concentration above 0.1% hydrogen peroxide is above that you're going into it needs to be prescribed by a dental professional. Below that, it's not really effective at whitening teeth. Yeah. So if they are using a legitimate kind of substance that we would use, and the reason why we use those ones is because we know they have no real detrimental effect to your teeth. They can cause a little bit of soreness to your gums or irritation, but there's nothing substantial that's going to damage the integrity of your teeth. Exactly. They're not causing like your teeth to structure to be damaged long term. So they get a bit dehydrated, but that's what causes sensitivity. Yeah, I would say avoid those. I don't know what's in them. I wouldn't want to validate. I don't know if there's like CE marked or that sort of thing.
It's good to have that bit of advice about the 0.1%. Like below that is not going to really work, and above that it should be a dentist. So really you shouldn't be buying anything on TikTok Shop or Shein for your teeth. We're going to move on to some questions and then our favourite bit, which is myth busting.
Okay.
So some questions that we've probably covered already.
Yeah, we'll whiz through the ones that we've already covered.
Thank you. Oh, this is an interesting one. How, I assume it's similar to what we discussed about with eating disorders, but how does morning sickness affect oral health?
Yeah, I mean, it's not morning sickness, is it? It's pregnancy sickness. And I know from experience, it can make you feel sick all day and all night. So there's the sickness element, but sometimes you can be sort of heaving and retching. So there's other elements to it that I'd like to mention, which is food cravings. So it is not a myth, I don't think anyway, that you crave things like vinegar. I definitely crave things like pickles and, fish. So people might have certain cravings.
Sugar,
people might crave sugar. Sugar cakes, they might be eating more. But also, actually brushing your teeth when you have pregnancy sickness and you're feeling nauseated, whether it's the sensation, the smell, the toothpaste, it can be really off-putting.
I used to vomit on the way to work.
Did you?
Yeah. Because of the teeth brushing, not because of anything else. It was, I don't know if it was the mint or if it was the sensation or whatever. But as soon as I brushed my teeth, I was like, oh, I'm going to be sick.
Yeah.
It's the teeth brushing that does it.
Yeah, I think there's a number of things there, and like we mentioned with the vomiting, you get the acid depending on how many times you're vomiting in a day. So they might want to be thinking about getting that high fluoride toothpaste, using a fluoride mouthwash,
Not brushing straight after.
So leave yourself space there, or have a piece of cheese if you can stomach it.
If you can eat cheese, that's a
sounds
great
like
thing
a
to
great-
do.
I could always
I've always got cheese in my
cheese.
pocket.
Pasteurised cheese.
Yes, pasteurised cheese.
Pasteurised cheese.
Have a mild cheddar.
So we talked about the oral contraceptive, sort of maybe changing oral health a bit, but someone asked, are you meant to disclose to your dentist what contraception you're on? You know, sometimes the form will say, any prescribed medication? Do I need to come in and tell you what I'm taking?
I think it should be mentioned.
Okay.
So pop it on there. That's good information for us to know, because then we might be more aware that might be, if we see more bleeding, we can then explain to you what might be going on, give you a bit more information there. And also it's important because of thinking about things like if we're prescribing antibiotics. So if we need to prescribe antibiotics, it's good for us to know so we can have a conversation with you about that. Because if you didn't know, if people don't know always about antibiotics in relation with oral contraceptive pill, that might be a thing to mention. So I say put it down. It wouldn't hurt. Will they be able to tell the difference between like a progesterone only pill and a combined pill? Probably most dentists.
We'll test Janine. So what contraception do you think of?
So most dentists wouldn't go into that, but I think to let them know would be sensible. Yeah.
No, definitely.
And I think the only other question that we've not covered is, why do I sometimes get a metallic taste in my mouth around my period?
Yeah, interesting. So around this, your hormones, and we were talking about that, estrogen going up, estrogen going down. Around your period, your estrogen goes down and you get a difference in taste. This can also happen around menopause. So people have some of the research suggests a more desire for sweet things and more kind of acute taste around things that are salty or bitter or sour. So you're just more aware of taste. So it's not perhaps that there's a different taste. It's just that the way your brain is interpreting flavours has changed because of that estrogen going down.
Interesting.
Yeah.
Interesting.
Didn't know that.
Okay, should we do some quick myth busting?
Yeah.
Our first one, which will hopefully be a quick true false. Bleeding gums are totally normal now and again.
Yes, and if you see them, then it's a sign to improve your oral hygiene.
Yes.
So don't leave it alone. Go for it and
Just be
upregulate.
better.
Yeah.
Do better.
Even Janine needs to be better
I
sometimes.
need to say that.
Another one, you should avoid the dentist whilst you're pregnant, trying to conceive, or breastfeeding.
No, there's no reason to avoid the dentist. Go and make friends with your dentist, and they'll be able to
And
give
it's
you
free,
lots of
don't avoid
information.
them.
Yeah, so
And
when
it-
you're
and if you get
pregnant,
into
but
the
also for a
NHS.
year afterwards,
Yes.
which is something I need to sort out.
Great.
Definitely make sure you're going there.
One that I'm not entirely sure we've touched on, mouth ulcers around your period mean you're run down.
So, I mean, I don't know that they mean that you'll run down or not, but what I do know is that your hormones can impact on the integrity of the tissue in your mouth, right? The oral mucosa, and it's that causes issues
That
around
would
your
fit
period.
in with what you'd said before about just trying to piece together the hormones. And so, just before your period, you have a big drop in estrogen and progesterone, and then if that's affecting how healthy the skin in your mouth is, that might mean you're more likely to get an ulcer. But it's not actually your period causing an ulcer, it's more to do with the hormones.
Yes, exactly.
Yeah.
It's more to do with the hormones.
That makes sense,
Amazing.
yeah.
Hormonal fluctuations across the cycle can cause bad breath.
Oh, do you know, I'm going to say I can't bust that myth. I wouldn't want to say either way because I don't know for certain. And I wouldn't want to deny that if that was the case. I mean, if, for example, you're getting more gum disease and you're getting more gingivitis around your ovulatory phase and also that kind of second peak of estrogen you get towards the later part of your cycle just before your period happens, theoretically, yes, you could be feeling a little bit like your breath isn't smelling as fresh, or if your mouth is a bit dry.
I was just going to say that.
Yeah.
Is that to do with dry? Because
Yeah.
if you have a dry mouth,
Could
I think
be.
I'm always more conscious of having bad breath. So if the hormone changes are making you have a dry mouth, then I guess that could.
Yeah, exactly.
But we know what chewing gum to use now.
Yeah.
Xylitol.
Sugar-free for sure.
Sugar free.
Yeah. So then one that we might have touched on a tiny bit was microplastics in your toothbrush and floss are actually dangerous endocrine disruptors that will mess up all of your hormones.
Oh, wow. Okay,
I feel like we need to go
great
France for that
online-
answer.
Yeah, I don't want to be scaremongering here. However, I do also want to be balanced. So there is a small amount of microplastics that are released when you brush your teeth if you're using a brush that's got plastic bristles on. And I think it's fair. I want to say that. I don't want people to go away and panic about that. It is a very small amount.
Brushing your teeth is so much more important.
And brushing your teeth is very important. So it does release. If you are concerned, there are alternatives. So you can find plant-based heads now. I think they're made of something like castor oil, or you can get boar hair bristles.
I was going to say, I saw that myth on a TikTok that was an advert for a bamboo toothbrush that you could buy on TikTok Shop.
Yes, exactly. So there are some other eco-friendly kind of plastic or plant-based or BPA-free out there. So you can be judicious about your choice, but I don't want to scaremonger or put anybody off brushing. It's really important to brush.
Hilariously, this myth I wrote down thinking, this is funny, but now from what you're saying, I think it might be actually true.
There you go.
Menopausal women should eat cheese because it boosts saliva production and increases calcium, sip green tea, reduces harmful bacteria and plaque, and chew licorice root, fights bacteria and protects gums. It's the cheese bit that we've mentioned.
Oh, yeah.
But that was the bit that maybe put it in because I was like, oh, can't be true.
What I would say is that we know if you have something sweet, and we've talked about this, that cheese can help a bit with the acid. When it comes to things like sipping green tea and chewing licorice root, I would say I don't know enough on the evidence to say yes or no either way. That's certainly not something that is like in the mainstream or that I would recommend as a dental professional. I'd be really careful about things sort of checking in with your tea. What's the acidity of tea? I don't know what the acidity of kind of a green tea is.
Green tea if you're putting honey in it.
Exactly. If you've got a sugar in it and you're sipping it throughout the day.
Don't sip it throughout the
I
day
would say
like
water is a really safe bet there. So maybe chew some water and have your xylitol chewing gum, which we know are two things that are not going to do any harm. And I think that's a sensible way forward.
But definitely cheese.
Oh yeah, no, that's definitely. I'm taking that home. I'm just gonna have cheese every now and again. It's good for my teeth.
This is my new favourite fun fact.
Amazing. Well, that's us kind of rounded up. We've learned a lot. I've really enjoyed the discussion, and I think our listeners will again have had their kind of eyes opened into how important your mouth and your dental hygiene is, just for like not just your smile and your confidence, but actually for your future health, your current health, and it's been really interesting. Thank you for joining us.
Thanks so much for having me.
So we always do a quick disclaimer just to say that anything that we've discussed are our own opinions and are not affiliated with where we work, and also anything we've said is not personalised medical advice.
Yeah, and if you've enjoyed the episode, if you've learned something new, if you're now going to go and see your dentist because of what we said, please leave us a review wherever you get your podcasts.
So it might seem like a little thing, but giving us a 5-star review pushes the podcast out to as many people as possible, and we really want to break down barriers, bust myths, and give out really good info.
Yeah, we really want this episode and the podcast to reach as many people as possible, so if you want to be a part of that ripple effect, then please hit the like button.
And make sure you're following us and engaging with all of our content on social media at Between Two Ovaries.
Bye!